All right, 7 o'clock. We are going to give everybody about 3 more minutes to get in, and then we'll go ahead and get started. Welcome, Ronnie. Welcome, Elizabeth. Welcome, everyone. Welcome to our usuals who are coming from all over the United States, including Florida. Where else do we have people from tonight?
We have Richmond, which is just west of Houston.
Oh, welcome. We have someone from North Coast, California, Redlands, Silicon Valley, Oregon. Wow. Maryland. Nice. Portland, Northridge, yes. Part of Los Angeles, of course. All right. Good evening, everyone. My name is Patrick Botts Forbes. I am the LAFD CERT Central Bureau Coordinator. I am also a California EMT. For those of you who don't know, the way the EMT system works in terms of certification is that in order to become an EMT, you have to take 120 plus hours of training. And then once you pass your class, you're allowed to take the national exam and become a nationally registered emergency medical technician. At that point, you can apply to become a state EMT. So in this case, California. And I registered through the county system, so LA County EMT. In the case of California, we don't need to maintain our EMT, our national EMT license. And unfortunately, mine lapsed due to it was actually I only had it. You're supposed to have it for 2 years. I only had it for 18 months, and it lapsed. Didn't get a chance to renew it, but I maintained my California EMT, and at some point, I'd like to get my national back. And then every 2 years, you need to do continuing education trainings and other hands-on recertification, skills verification. And I'm up for renewal later this year, so that'll have to go through all that to get that back or keep it. Um, go ahead and get started as people trickle in. So tonight we're going to have a little scenario, and then we're going to review triage, and then we'll go ahead and get back to the scenario, and we'll have a quiz and see how you do triaging the survivors of the incident. Tonight's scenario, we're in California, so our number one concern is, of course, earthquakes. But quite frankly, California gets most kinds of disasters. Um, we have fires, we have blizzards to some degree. We've been hit by a lot of rain in the last couple of years, floods. We've had a couple tornadoes even touch down in the LA region. Um, so the reason why we pick earthquakes is because the amount of damage and the amount of chaos that an earthquake can cause and the unpredictability is if you prepare for an earthquake, you're pretty much prepared for any kind of disaster, be it in terms of power outage, inability to access money through an ATM system, credit cards through the internet, or being able to restock supermarkets and get to gas stations and refuel your vehicle. So pretty much any kind of disaster, if you're prepared for an earthquake, you're prepared for any of those. Of course, that's not to diminish the impact other parts of the country have with hurricanes, tornadoes, blizzards, dust storms, whatever else that you have out there. But we typically drill on that earthquake. In other parts of the country, you'll drill for something that's more common in your area. So the scenario today is that there was a moderate earthquake in the early morning. The Los Angeles Fire Department, as well as all the other local and regional fire departments, are responding to emergencies. And you're part of a three-person damage assessment team that's deployed out from your local staging area. So the idea behind the community emergency response team is that the fire department trained us so that we can deal with minor emergencies at the local level, so that the fire department can deal with the more critical emergencies that requires a more advanced training. If we can prevent something from becoming a true emergency where somebody has to go to the hospital or they might lose a limb or die, then we free up the resources that would be committed to assessing them and taking care of them. So, for example, during the Northridge earthquake, the number one injury was actually cut up feet. Everything came off the shelves. People ran through their homes barefoot or in socks, and they stepped on glass and other debris to get to their family members and make sure they're safe. And left untreated, a foot injury is actually pretty severe. If a foot injury becomes infected, you could actually lose your foot or toes or something, especially if you have underlying conditions like diabetes. It becomes very much a major problem. So one of the things that we can do is treat a minor injury, minor foot injury, clean it, bandage it, and make sure it doesn't get any worse. And we might save that person from having to go to the hospital. So after the earthquake, we're going to assemble into teams, meet at a staging area, find out how bad it is, and see what we can do to help our neighbors. First thing is we need to know how bad this earthquake was. So we'll send out damage assessment teams consisting of a team leader, a radio operator, and a scribe, and really walk the neighborhood and report back to the staging area any kinds of incidents that we discover. An incident is something we can deal with or do something about. It might be that we need to report it up to the fire department and get professional help there, or it might be something as simple as helping someone with an injury and treating them and getting them back to their home where they can rest and recover. On your way back from your damage assessment, you discover you're still about half a mile away from your staging area. You hear tires screeching and the sound of a crash. As you run towards the sound, you discover that a school bus has hopped the curb and crashed into a tree. It's rolled over its side, and as you're approaching, the back of the the back of the bus, the door, ooh, sorry, let me try that again. The door on the back of the bus pops open and a teenager falls out. So, what do you do? And this is how we've been training our teams in the field is we give them scenarios and walk them through step by step. We give them pieces of information and lead them on a journey. We are storytellers, and effectively, if you've ever done tabletop role play, that's really what we're doing. We're a dungeon master or a facilitator guiding the team along this journey. And we give them points where they interact and they tell us what they're going to do. And then we keep them along the journey because their actions will immediately dictate how the story changes and what they're able to do. And so we're going to review triage and then we're going to come back to the scenario and I'm going to ask you what you're going to do. I'll pop up a quiz and let you vote on how you will triage people. Triage comes from the French word. I'm not even going to try and pronounce that one, but it means to sort. And in essence, what we're doing with triage is we're trying to make order from chaos. During a disaster, during any kind of incident where we're overwhelmed, um, everything will be chaos. And the best we can do is to try and make it more orderly and deal with the chaos in a productive way. If we let chaos reign, people are going to die. But if we can do something to deal with it, deal with the severity of it, deal with the most critical parts of it, and start to really put our response together in an orderly fashion, we can get through the chaos and start to bring everything under control. So the first thing you're going to ask when you get to a scene is it safe? As CERT volunteers, as responders that have been trained, or people who are we're helping that are untrained, our primary concern is our own safety. We don't want to bring a victim to an incident. And that saying is really rule number one under the community emergency response team training. It's the same policy you follow if you're on an aircraft and there's an incident, decompression of the cabin, for example, and the oxygen mask comes down. The flight attendants tell you before you help your child, put your own oxygen mask on first. And that's because if you lose consciousness, you can't help your child. And so you want to take care of yourself, then your child, and then, or your family, and then help others, but to do so safely. Because if you become injured, you're not going to be able to help anyone. When you've established that the scene is safe, you're then going to have to establish what are your priorities. What are you going to do first? And that's where we come into the second rule of the community emergency response team, and that's how can I do the greatest good for the greatest number of people in the shortest amount of time? That time factor is always critical because we can discuss ad nauseum what the best course of action is, but while we're discussing this for 30 minutes, somebody could be bleeding out and be dead by the time we decide to actually take action. Or we could get into an argument whether or not it's safe to extract someone from a building rather quickly, or do we need to make sure that we put them on a backboard, hold C-spine, have enough resources to get them out without causing additional injury, and then the building collapses on top of us during this discussion or debate. So that time factor always needs to be considered. And we see this time and time again during CERT drills that people will overanalyze, over discuss. Instead of taking action, they want to come up with the best solution, forgetting that time is a factor. So oftentimes in our drills, we'll put the added pressure on it and try and make people make that decision faster and sooner than they would like to, just because we need to make them understand the urgency of the situation. Under that consideration, who do I help first? And who can we save if we can help them right now? More importantly, or just as importantly, perhaps, is who can't we save even if we have all the resources in the world? And that's a really, maybe it's a bleak way to look at it, but it's realistic. You don't want to spend a huge amount of time, effort, and energy and resources on someone that there's no way you're going to be able to save them. And so we teach that in a mass victim incident, if you encounter someone who needs CPR and you have 10 other victims or survivors there, you're not going to perform CPR on this one person because you need to save as many as you can. And unfortunately, there's the reality.
You froze, Patrick.
We can't hear you.
I'll send him a text.
Thank you.
Just lighten up the environment. This is the first test. What do you do if the instructor leaves?
I was just sitting, have your grandkids sing Frozen.
You get someone else to do the talking. Though Frozen's not a bad idea.
That's true. Where's Chin? Normally he's the assistant or support. That's interesting. He's not on tonight. But I do like Frozen too.
Oh, he's back.
Can you guys hear me now?
Yes.
Yes, we can.
We've decided that the song of the day is going to be Frozen.
Patrick, you left off talking about having to make the decision if somebody needed CPR, you're not going to give them CPR because it's about helping the greatest in the greatest amount of people for the greatest good. So that's where you left off.
Thank you. Yeah, I heard Pierre say that I froze, and then I guess I completely lost it. So we'll get back on track real fast, and thank you all for bearing with me. I usually make fun of Chin for his poor internet, but apparently that's my condition tonight.
Patrick, I asked where.
Did I lose you guys again?
So that's funny that you mentioned him.
Did I lose you guys again?
No, we still have you. Whoever was Ronnie,
You're all right.
Where's Mikey?
Just saying you.
We still have you.
Yeah.
Yeah, we can hear you.
All right.
And Chin is close, I believe.
If my Wi-Fi is messing up, I'll switch over to cellular, and hopefully that'll work better. Okay. Text me if you lose me again. Okay. Chin, I think, is still in Paris, actually, so, and he's enjoying French cuisine and nightlife right now. All right, so the issue is that people are going to die, and that's unfortunate. But the reality is you want to save as many as you can, and you have to make a decision on how much time and effort are you going to put into one person if you have no way of actually reviving them. And it's hard to say, and we try and be really honest about it. But that's not the primary concern, of course. We want to focus on the people that we can save. But the reality is that you're going to have to make decisions, and you're going to have to make them quickly. If you spend too much time deciding if someone is salvageable, you might actually lose more people. And the reality is, if you may encounter someone who is currently alive, you might be talking to someone, but there is a hole in their chest and you can see through them. You can see the ground beneath them. The reality is this person is unfortunately not going to make it. And that's going to be a very hard decision when you come to that. But I want you to understand that now and think about that reality so that you're not shocked by it, unfortunately, if you ever encounter this. And hopefully you never will. But we have to be realistic here. Um, and furthermore, do I have the right equipment and resources to safely work on this particular problem? And if you don't, then you put yourself at risk, or you make it more difficult to the point where you can actually hurt other people if you don't have the right equipment. And so that's very fundamental in understanding, is this an incident that I can deal with? Do I have the right training? Do I have the right equipment? Do I have the right resources to make sure that we can do this in the most efficient and best possible way? Or should another team take this and I'll do something else? So when you're figuring out how to triage, you really want to start looking at, how do I categorize people, survivors, into priority? And the first, of course, is actually, how many survivors do I have? If you're doing a quick size up, you need to identify the number there. Because at the end, when you come to the conclusion that you've helped 5 people, but your early size up said there was 7, you either counted incorrectly at the beginning, or you missed somebody and you now need to figure out where those other 2 people are. So how many survivors do I have? And then prioritize, how many immediates do I have? How many delayed? How many walking wounded? And how many deceased? And one thing we'll notice is that there are colors and there are words that go with each of these colors. And red is always immediate, yellow is always delayed. I don't like the word minor um, with green, simply because minor has 2 connotations. If you come, and the scenario is a school bus, so how many minors do we have? Well, minor is someone who's under 18. So this word is ambiguous. Am I talking about how many people under 18 do I have, or how many people who are walking wounded? And so I will use the word walking wounded, but you can always use the color as well. So how many red do I have, or how many immediates do I have? How many yellows do I have, or how many delayed? How many greens, or how many walking wounded? And it's not ambiguous what you mean when you say this. But if I say, how many minors do I have, depending on who you're talking to, that's going to change that conversation completely. And finally, and this is the one we tiptoe around, how many deceased or expectant do I have? How many black tagged people do I have? The other word for that, of course, is dead. And we'll get into when we use that word and what it means. So what we teach in LA, and there's different ways to do triage, but we use the START method: simple, triage, and rapid treatment. And what you want to determine is, in a rapid assessment, who is going to die in the next 60 seconds without help, who is going to die in the next 60 minutes without help, and who is injured. It may take them, without treatment, several days before they're going to die, or maybe a full day. But the priority is, what can I do right now to save the most number of people and get the most people who will die without treatment to definitive care? And that's the purpose of triage. So we're going to categorize people into red or immediate. This is the people who are going to die in the next 60 minutes without treatment. If I don't do anything to them, if I don't get them to care, they will die. And maybe there's a chance to save them if I can get them to immediate care right now. Yellow delayed, how many people are going to die in the next 24 hours? And the interesting thing about human behavior is that the people who are delayed might be pretty severely injured, but they're not going to die immediately. They might think differently. And so you don't want to discuss, when you're doing triage with them, what the categorization means, because someone may get into an argument with you that their hangnail is going to kill them in the next 60 minutes and they need to go to the hospital right now, versus the person who has a piece of rebar stuck in their chest and they're having trouble breathing. The ones we always forget about are the walking wounded or green tagged. These are the people who have no obvious life-threatening injuries and they came out of the incident when you called them, you can't forget what you did with them. You can't ignore them and focus your attention on the people who are obviously injured because the human body is pretty interesting. When you're in a fight or flight or you're in a trauma, you have adrenaline pumping through your body, and you might actually be severely injured, but be able to get up and walk away from it. And once that adrenaline runs out, you're going to collapse and you could actually be bleeding out and not even realizing it, or in shock and not even realize it. So when we get to the stage, I'm going to bring this up again, but you don't want to forget about your walking wounded. You want to re-triage them, make sure that they truly are walking wounded and not someone who is actually pretty severely injured. And then, of course, we talk about the black tagged or expectant or deceased or dead. And these are the people who they might already be dead when you get to them, or they may die even if you have immediate treatment for them. When you come up to the bus or whatever incident you're going to start triaging, you want to start the triage right away. You want to get as many people out of that incident as possible. And some people, when they're in a trauma or a sudden unexpected incident, they might not think to get up and walk out of there. What you want to do is you want to call out, direct people to come to me. And you want to make this loud, make this very clear. We're an emergency response team. Come out. If you can hear the sound of my voice, come to me. Get them to actually walk towards you. You want to call this out as loud as possible, maybe a couple of times. And as people come out, you want to visually assess them. Just because they're walking towards you, again, doesn't mean that they're not injured. If somebody is shuffling, they're very pale, they look like death warmed over, they probably are pretty severely injured. That doesn't make them walking wounded just because they were able to come towards you. Set these people down, reassess them, and make sure they're not actually severely injured. But for the people who do appear to be non-injured and they're walking under their own power and they appear to be able to do so well, you want to direct them to a specific location. I want you to go over there to that tree, sit there, wait for me. You, sir or ma'am, I need you to be in charge. Make sure everyone's okay. If someone loses consciousness or gets worse, I need you to come and grab me and let me know that this has happened. But don't let anybody wander away. If they do, okay, you're not going to stop them, but you want to give them that direction. So hopefully you can keep them in one place. And then when you go and actually re-triage them, they're all there. And hopefully no one has, lost consciousness on you. One important thing to note is you're probably going to have more survivors or victims than you do rescuers at this point. So if you have people who are not injured who can help out, there's a variety of tasks we can give them. As part of that assessment, you're determining their ability to help you. And if you identify people who might be able-bodied and willing to, ask them to stay with you and also, get a little bit of information. Hey, any idea how many people were in there? That um, just ask them questions, but don't spend too much time on this. Okay, are you willing to help me? Let's go in and help as many as we can. If they say no, that's perfectly fine. But if they're willing to, then put them to use. So one of the things that we forget about trauma is that the human body has a variety of bodily systems. We have a heart, we have lungs, we have arteries, we have veins, we have skin, we have muscle, we have bones, and all of these systems work together as well as a brain and neurological system. They all work in what's called homeostasis under most circumstances. Um, Trauma to any one of these systems or multiple systems can really throw that homeostasis off. And what often happens is when one system is thrown off, the rest try and compensate, but they can't fix it. And so the body trying to compensate is what's called shock. Someone will go into shock, and the body will try and keep that person alive longer until professional help can happen. And if is in shock, they need to go to the hospital. There's nothing we can do about it, except we can try and keep that person from dying on us, keep them from getting worse. So there's certain things we can do to deal with that. What you want to be on the lookout for is severe blood loss. That's the number one killer, is a hemorrhage. If someone has a major artery that's cut on the neck, on the arm, or on the inner thigh, they can bleed to death. They can exsanguinate. They can hemorrhage within minutes. And there's nothing you can do to stop that short of stopping that bleed as quickly as possible. So that's one of the things you're going to be looking for. And when we say we don't treat people in a mass victim incident, we don't treat the non-life-threatening injuries, the killers, the three killers that will kill them before we can get them to care. So if someone is spurting blood, bright red blood, we want to do something about that. We want to stop that as quickly as possible. And generally speaking, the fastest way to do that is going to be with a tourniquet. If you can, if you see someone spurting bright red blood, the first thing you should think of is, do I have a tourniquet on me? Can I stop this person from bleeding out? And so we actually teach now stop the bleed, and we do teach hands-only CPR, but stop the bleed has come a long way in prioritizing the use of tourniquets and stopping severe hemorrhage to the point where someone can actually be saved at a hospital versus bleeding out and unfortunately dying before they can get to care. And we actually encourage people now to have commercial tourniquets with them. And I don't think I've got one to demonstrate, but these tourniquets are about there's several brands of them. The one that I'm most familiar with is the CAT tourniquet, the combat applicant tourniquet. It's used in the military, but there's several different versions out there that are very similar in function, but they have different names. Um, we've come a long way in the teaching. It used to be even 10 years ago, we would hear first aid instructors say, if you put a tourniquet on someone, they're going to lose their limb. That is not the current teaching. The current teaching is that someone can have a tourniquet on a limb for 3 to 10 hours, maybe even longer. Get to the hospital, a surgeon will remove it, and they are not going to lose the limb. But if you determine someone needs a tourniquet because they're spurting bright red blood, then they have minutes to live if you don't do something about it. We'll take questions later. So hold on to that thought, and then we'll take questions at the end. The second killer is going to be someone not breathing. And that's caused for a variety of reasons. You don't know why. But if someone's not breathing and you can get them to start breathing again, then you give them a chance to live. For children, the number one cause of cardiac arrest is actually respiratory arrest. They stop breathing, and that's when their heart stops. It could be something stuck in their throat, could be the tongue actually can block your airway and cause you to stop breathing. If you're laying back and you got knocked out, your tongue might actually fall back over your trachea and over your airway and prevent you from breathing. And there's a simple technique we'll go over how you can open the airway, move that tongue out of the way without sticking your fingers in their mouth, and actually get them to start breathing again. There's other reasons if they have a piece of rebar sticking through their chest. might have collapsed their lung and they've got other issues going on. There's not maybe too much you can do about that, but certainly opening the airway is something you can try and do. Well, the third killer really is trauma to the brain or spine. If you're not a that controls everything. Your spinal column and your brain controls your breathing, your heart pumping, all of that. And severe trauma to that is unfortunately not something we can deal too much about. If someone has large burns over or severe burns over a large portion of their body, we don't think about this, but actually our skin is the largest organ in the human body. It covers everything and protects us from infection, but it also regulates temperature. And without skin, if you have severe burns, your body can't regulate temperature and you will go into shock very quickly. And you could possibly die of hypothermia even if it's hot out. So covering someone up and taking care of burns is something that you want to consider doing if you can't get someone to immediate medical aid. And then pretty much anytime the bodily systems are thrown off, it will lead to shock. And shock will kill someone if left untreated. And there's nothing you can do to reverse shock once it sets in. But understand shock is the body's attempt to save itself. And you can aid it in prolonging that attempt to save itself. After you've cleared the walking wounded and you've cleared the immediate, or you've identified the immediates, now you want to identify anyone who didn't get up and walk out when you called for them. If they're not dead, they're not immediate, they're not walking wounded, everyone else is delayed. And that's what we'll talk about as we go through the process. But that's the confusing part is, well, they appear healthy. We can't find any injuries, but they didn't get up and walk out. So are they walking wounded or delayed? And the answer is they're delayed because you don't know why they didn't get up and walk out. But you shouldn't make assumptions about that either. So when we clear the walking wounded and we get in and actually start going patient to patient, you're going to start where you stand. If you're in a bus crash and you go in through the back door of the bus, or you're in a building and people are screaming for help, you're going to not look around and try and prioritize who you think needs help. You're going to start the first person closest to you and start systematically working your way through because you don't want to miss anyone. You don't want to skip people and then go back to them. And you don't want to get confused. So you really want to have a game plan before you go in. And this is more important when you have a team with you so that everyone knows what the game plan is. But take a few moments, don't take too long. Take a few moments at the very beginning to assess, size up, strategize, and then move forward with a well thought out plan. And we've done this in drills before. We'll throw curveballs at you so that your plan falls apart. And if you fall apart with it, you could actually become part of the incident and become a victim of it. So if things are starting to go wrong and your plan has failed, don't hesitate to pull back, pull your team out, reassess, re-strategize, and then plan to go back in. Or maybe it's just not safe for you to go be in there. And that's perfectly fine because we don't want to add to the problem by becoming victims of the incident ourselves. When you start working on someone, you're going to perform any life-saving techniques, such as opening the airway, stopping any hemorrhaging, but you're not going to perform CPR if the person is not breathing, has no heartbeat, or isn't breathing but does have a heartbeat. You're not going to do anything more than try and get them to breathe. And if you can't get them to breathe, then you're going to move on. One of the mnemonics that we'll give you right now is 32 can do. We're going to talk a little bit deeper than you might have heard in your CERT class before, but you really want to fall back on this mnemonic. When in doubt, 32 can do. Are they breathing faster than 30 times a minute? Is their skin perfusion or their capillary refill take longer than 2 seconds? Can they follow simple directions? Well, there it is. This person breathing faster than 30 times a minute. Now we say that, and unfortunately, we don't explain it well. This doesn't mean count how many times they're breathing within a minute. This is look at them and tell, are they breathing way too fast or also way too slow? Um, I don't want you counting breaths. Look at someone, we know what normal breathing looks like. We do it. Most of us breathe normally. Understand that 30 times a minute means that someone is breathing every 2 seconds. It is very apparent that something is wrong. If they didn't just run a mile or run up a flight of stairs and they're standing there going, something's wrong. They're immediate. Don't care. They're immediate. Move on. Tag them, move on. Does their capillary refill take longer than 2 seconds to refill? There's reasons for this. It might not be related to the incident, but we don't care. Tag them immediate, move on. Can they follow simple directions? Oftentimes, we get hung up on trying to ask people their name, ask them something that has to do with the situation they're in. If we don't know what their name is, does that actually give us anything useful? If they say their name is Bob, do we know if they're accurate, if they're telling the truth, if they're lying, if they can remember their name? Maybe your name is Bob and you have Bob on your name tag and they just read it off. Um, don't ask them questions like that. Ask them to follow simple directions. Can you follow my finger with your eyes? Yeah, you can ask how many fingers am I holding up, but extend your hand. Can you shake my hand? Doing the simple follow directions tests allows you to assess a couple different things. And we'll get into that as we go on. But it's, in my opinion, a much better technique than asking them things that, what's today's date? Honestly, I don't know what today's date is right now. It's what it says on my calendar, and that's about as far as I can think at the moment. So I may give you a wrong answer, but that doesn't mean I'm immediate. Well, maybe it does. Okay, so we've broken triage down into 10 easy steps. We covered the basics, but let's dig in a little bit deeper here. We re-emphasize that before you even go in, you want to make sure the scene is safe. If the scene is not safe, you do not go in. You do not put your team at risk. You do not put yourself at risk. You call for help and you make sure that other people don't go in and put themselves at risk. As you approach, you want to look at all 6 sides. There's obviously what's in front of you, but there's what's behind you, behind the building, or behind the incident. If there's a fire behind there and you don't see it, you go in, the building might catch fire, or the truck or school bus might be on fire, and suddenly you're involved in it and put yourself at risk. What's the left? What's the right? People forget all the time what's above, and just as importantly, what's below. And if there's the possibility of this school bus went off the side of the road and isn't stable, and you go into the school bus, it might fall off the side of the road and take you with it. So always pay attention to all 6 sides. Don't forget what's behind it, what's above it, and what's below it. And before you go in, make sure you have a plan on how to get out. Make sure that plan includes what am I going to do, or what are we going to do if where we came in is no longer safe? If you go in and a fire starts behind you, what are the other exits to get out of there? Make sure you have that game plan. Make sure you tell your team what the plan is in case you get separated and where you're going to meet up, or if things get unsafe and you need to evacuate quickly. Then before you even go in, you're going to call out. If you can hear the sound of my voice, come to me. You want to get as many people out of that before you even go in. Because A, if you can't go in, then you save those people because you got them out of there. And B, they might be useful support for you. Again, you don't want to lose them. Tell them where you want them to go. Tell them to wait there. Put someone in charge saying, okay, make sure nobody wanders off. Come get me or come call for me. Don't go in, but call for me if someone gets worse or loses consciousness. And then, of course, visually inspect them as they're walking past you. That's why you don't say, okay, if you can hear the sound of my voice, go that way. No, it's come to me. I want to look at you. I want to do a head to toe visual assessment of you. Make sure, hey, why is one leg shorter than the other? And you're looking very pale and you're actually breathing kind of fast. Um, get that assessment out of the way, and anyone who fails that visual assessment, I need you to sit down right here. We're going to check you out. We'll come back and reassess you when we're done. But if you're having them walk over there and they trip and fall and hit their head, you've got another victim on your hands. And you, are you willing to help me? Okay, let's go back in and we're going to help as many of the other people in there as we can. Number 2, anyone who is still in there is either immediate, delayed, or dead. Red, yellow, or black tagged. When you do the tests, always remember that if they're immediate, they're immediate. If they fail any of the tests, they're immediate. Don't keep testing and checking. You're trying to identify who is going to die in the next 60 minutes if we don't get them help. Once you've identified that they need immediate medical attention, you've identified that they need immediate medical attention. So start where you stand. Start moving through methodically through the survivors. Have that game plan. Okay, there's 3 of us. One person's going to stay outside with the radio and call for help if we get trapped in there or we can't get out. Or there's 5 of us or 7 of us and we're going to split up. You 2 go this way, you 2 go that way. Have a plan. And every plan is going to be different. It's going to be very situational dependent. When you approach someone, introduce them. Most of us are not firefighters. I did see someone with the LAFD cap on, but most of us are not firefighters. Most of us are not professionals. We're not wearing uniforms that identify us. We're bystanders or we're community first responders. And we may or may not wear a uniform, but also people may not know what our uniform means. When I'm wearing this uniform with the LAFD patch, people think I'm a security guard or a parking attendant. They don't know that I'm an EMT and that I'm here to help. So introduce yourself to them, and that's going to tell you a couple things. You're going to see their reaction. When you introduce yourself to them, if they answer you verbally, or I'm sorry, introduce yourself and ask if you can help. That's the key thing. Get permission. Hi, my name is Patrick. I'm a first responder. I'm here. Can I help you? If they stare at you blankly or they don't respond verbally, it tells you something. If they say, yeah, it hurts, please help, they answer you verbally, they're breathing. That answers that first question is, are they breathing? But you also get an idea of their cognitive ability. If they stare at you blankly, something's wrong. I might just tag them red at that point, and move on. Or if they gesture that they can't talk, that's telling me something's wrong with their breathing, and I might need to sit them back, make sure their airway stays open. If they refuse to help, remember, we're not professionals. Get permission. If they say, no, I don't want your help, move on. That's their choice. Don't force yourself. If you get there and you see that they're not looking at you, you introduce yourself. you try and get their attention, they don't respond, then you want to see if they're breathing or not. And you want to be quick about this. Um, if they don't look like they're breathing, what you want to try and do is the head tilt chin lift. You're going to, um, that's not a really good picture. Yeah, so when we lie flat, the tongue can easily fall back and occlude our airway. And so by tilting the head back and lifting the chin, you pull the tongue away from the airway. And if they gasp for air, then you know that their tongue was actually blocking their airway. Now, the problem is, as soon as you let go, that tongue might actually fall back and block their airway again. So this is where having a bystander or walking wounded who can help you keep their head tilted back and their chin lifted can help keep this person alive. You're gonna mark them red tagged immediate because they failed that test. So there's no question, there's nothing else you're going to do, but you want to make sure that you keep their airway open. If you don't have anybody who can help, what you can do is put something underneath the back of their neck, and that's going to keep their head leaned back slightly and hopefully keep their tongue off their airway. If they don't start breathing immediate, and it will be pretty obvious because if you unblock their airway, the body is going to react to that. When it gets air, it's going to immediately suck it in. It's going to be very visual and audible. They'll be gasping for that air because the body has been without it for possibly a couple of minutes. So if they don't respond and let let the head return to its normal position and give them one more chance. Let go, get a beat, and then retilt and lift their chin again. You want to give them that second chance to breathe. If they still not breathing, you mark them black tagged or deceased, and then you move on. There's nothing you can do for them at this point. There's probably other people in there that you can save, hopefully. But if they do start breathing, mark them red, move on. There's a better picture of the head tilt chin lift and how you're moving the tongue out of the way and opening their airway. So if the person is responding, they're breathing, and they consent to you helping them, if you touch them, and when you touch them, make sure you explain what you're doing. Again, we're not professionals. We're not in turnouts. We don't, look like firefighters necessarily. We want to narrate to the person that we're helping, but also to possibly anyone who's recording us. Because there can be situations where we're blocking what we're doing or something happens and the person responds badly to it. And it can happen in any case, but especially if you're a large male and a small female or a child, you want to avoid any kind of risk of looking unprofessional, looking like you're doing something incorrect. Explain what you're doing because it's going to put them at ease. If you sound confident, you sound like you know what you're doing, even though you're not dressed like a firefighter, hopefully they'll understand that you're there to help them and they're going to be a little more relaxed. But if you start touching them, grabbing them, and doing things, you can cause them to panic and fight you. And that's the worst possible scenario. The worst thing that could happen is they push you away and say, "What are you doing?" And someone's got a camera on you, and now that ends up on YouTube. And yeah, you tried to help and you end up getting sued for it. And there's video footage of you doing something wrong. So keep that in mind. But it also helps if you have someone with you who's assisting you scribing, you're describing what you're doing, they can document it as well. And that's a good thing to have if you can do it. You're going to observe their breathing. Again, you're not going to count it. Are they breathing too fast or too slow? If they don't look like they're breathing and then periodically they go, it's called agonal breathing. It's not breathing. The body is gasping for air because it can't breathe for some reason. And that's the too slow part of it. If they're breathing normally, you're going to move on. But if they're not breathing normally, agonal breathing, there's not too much you can do about it. But if they're breathing too fast, mark them red. They're breathing too slow, mark them red and hope that you can get back to them or something can be done about it. Maybe check their airway, do the head tilt chin lift. But for the purpose of this, if they're breathing too fast, mark them red and move on. If they're breathing normally, we're going to move on to the next test. You want to check the person's skin perfusion. I talked about shock earlier. Shock is where the body tries to pull all the blood from the extremities in your fingers and toes into the core of your body to perfuse your heart, lungs, and brain. And what happens is if you look at your fingers now, and you can either look at the nail bed, or you can look, if you have nail polish on, you can look at the fleshy part or the palm of your hand. You can also do this with your nose or your lip. And be careful about touching other people's noses and lips. That's why we want to do the fingers. But if you pinch your fingernail, it should go white and then immediately return to color. If you have bad circulation, that may not return in 2 seconds. But for normal people, especially younger people, it should return to color within 2 seconds. If it does not return to color within 2 seconds, it's a sign that something's wrong. It might not be a sign that they're in shock right now, but you don't care. Mark them immediate, mark them red, and move on. If it does return to normal color within 2 seconds, then we're going to go to the final test. Can they follow simple directions? Can do. Again, don't ask them what their name is. Don't ask them, do they remember what happened? Don't ask them what day of the week it is. Ask them, can you follow my finger with your eyes? Can you squeeze my hand? Can you lift your hand? Can you just follow simple directions? Now, they might not understand English. They might not be able to hear you. They might, and I discovered this at a training, there might be religious reasons why they're not going to touch you, or cultural reasons, or whatever else. So that's why you want to have a couple of tests in there to see if they can follow directions. If they can follow any of these directions, you're gonna get an idea of what their mental state is. If they're following directions but it's slow, they seem confused, something seems wrong, go with your gut. Assume that something's wrong, mark them immediate, and move on. But as you ask them to follow these directions, if they can follow those directions and you don't feel like something's wrong, then you're going to mark them delayed because they didn't get up and walk out, but there's no reason to believe they're going to die in the next 60 minutes. So you're going to mark them yellow or mark them delayed and then move on to the next survivor. If they're not deceased, they're not immediate, they're not walking wounded, then they're delayed. Okay, so we all know how to triage, right? So meanwhile, back at the crash, remember there was an earthquake early this morning. LAFD is responding to critical emergencies. You're in your neighborhood helping your neighbors out. You're on a damage assessment team. There's 3 people on your team, team leader, radio operator, and scribe. You've walked your neighborhood route. On your way back to the staging area, still about maybe 30 minutes away from the staging area, you hear tires squealing and a loud crash. As you and your team run towards the sound of that crash, as any good responders would do, You find a school bus that has hopped the curb and crashed into a tree. As you approach, the back door pops open and a teenager falls out. What do you do? So, I'm going to follow triage procedures. Make sure the scene is safe. The engine's still running, tires are still spinning. Is that safe? Do we see smoke? Do we see fire? Do we see electrical lines? Maybe they hit an electrical pole and the lines are now down on the ground. Is that safe? Do we know if the power's out? Doesn't matter. If the power is out, can we be assured that the power is not going to come back on while we're in touch with the ground surrounding those wires? Or the school bus might be energized and we touch it and we get electrocuted. We can't make those kinds of assumptions, but we can identify what might not be safe and decide, okay, say for the sake of argument here, there's no signs of down electrical lines. There's no the wheels aren't spinning. There does not seem to be a fire. Okay, what are my priorities? How can I do the greatest good for the greatest number of people? Who needs help first? Who can be saved if we can help them right now? But as we go through this, who can't be saved even if I have all the resources in the world? And do I have the right equipment and resources to safely help with this problem? So, you're going to assess the scene, do a 360, walk around, don't rush in. Then proceed with caution. If it's not safe, back away. But do I have the right resources and equipment to work on this safely? It's a three-person team. It's a large school bus, there might be 30 kids in there, maybe more. I need help, right? Call 911. Well, if there's an earthquake, 911 might not function. Your cell phone might not have signal. If you were dispatched from a staging area, you have a radio, call staging, let them know what you encountered. Call them, let them know that you need help, need additional resources. Call them, maybe they have contact with the fire department. Try and get help coming to you because you're going to need it. When you're calling on the radio, you well, let's go back. Let's talk about what the fire department does. If they're the first person on scene, if it's an engine or an RA, whatever gets there on scene, they're going to do a size up and they're going to call for whatever resources they think they may possibly need. They'll call for more resources than they actually may need because they can always cancel those resources en route. But if they discover they need more resources, now there's a delay in getting those resources assigned and moving towards them. So they'll call for more resources than they need and then cancel the ones they don't. Same thing. This is bad. I need all the help I can get. I'm going to call staging. I'm going to say, hey, if you can get the fire department, send them here because this could be really bad. When you're talking on the radio, we don't do it professionally. Most of us don't anyway. And so it's something we don't practice enough. Fire department practices on the radio. They're on the radio all the time. It's a skill that you need to really hone and practice as much as possible. What you can do is you can break down your radio call into the 5 W's. Who are you calling? Who are you? Where are you? What do you have and what do you need? If you form your message, if you write down these 5 W's and then read it bullet point by bullet point, you'll have a good message. Staging. This is Alpha Team. We're at the corner of bus crash and tree. We have a school bus into tree, unknown number of survivors. We need help now. Simple, easy, short, concise, and to the point. If staging has questions, they probably would, they'll ask them. But the main thing is to say it as succinctly as possible and get the help coming that you need and get off the air. Don't talk about the color of the bus. It's a yellow school bus with white trim. Somebody painted daisies on it. The license plate number, none of that matters. Short, concise, and to the point. Staging, this is Alpha Team. We're at the corner of crashed bus and tree. We have a school bus into tree, unknown number of victims, unknown number of survivors. We need help, as much help as we can get. Then make sure they've confirmed that they got your message and do what you can do with the resources you have. We're teaching now about incident numbers, and that's so that you can quickly refer to what it is. Staging, this is Alpha Team regarding incident number 7. So every team is going to do it slightly differently. It just aids instead of having to say staging regarding the incident at school bus into tree. Staging, this is Alpha regarding incident number 7. If it's a small team, you don't have that many resources, do what you can, but we design the damage assessment teams to be 3-people teams for a reason. We don't want you doing stuff and putting yourself at risk. We don't want you splitting up the team. But if you need to go in, the team leader stays outside with the radio in case the team members who are going in have a problem and can't get out. At least that team leader can call for help. You don't want everybody going in and then the bus rolling off the side of the hill and nobody being able to call for help, or nobody being able to get help, or alerting somebody that this has happened. Larger incident response teams are going to be 5 or 7. We do the odd numbers for a very specific reason, and that's because we want to make sure that we have that team leader as the odd person out. If you have an even number, you can split them evenly. If you have a team of 4, you can split 2 and 2. Team of 6, 2, 4, and 6. But if you have an odd number, then that it should tell you that you need to make sure that you're not splitting up in a way that makes things unsafe. All right. We called for help. We let staging know that the bus has crashed. You call out. If you can hear the sound of my voice come to me, people start coming out of the bus. They're all groaning, moaning. They look injured, but you're not seeing any severe injuries as they're coming out. No one looks like they're about to die on you. Tell them go over there at that tree, stay there. I want you to come with me. You keep everybody else safe, and then you're going to make entry to the bus. We know everybody in the bus is either immediate, delayed, or dead at this point. There should be no walking wounded in there. We cleared them out. That was the point of that. As we get into the back of the bus, we're going to go with the first person, the closest person to us, and tell the team, okay, you're staying out there with the radio. The 2 of us are going to go in. We're just going to go person to person until we get to the front of the bus. Simple plan. If anything happens, get out the way we came in. If we can't, try and go to the front of the bus or out the side window. All right. I think we kind of get this all. We don't need to rehash it one more time. So when you're doing triage, the professionals use triage tags. These are about $2 each. I do not recommend that you do triage tags. I recommend triage tape, such as what's on the screen here, or what we've started moving towards are wristbands that tear off and then they adhere to itself. These wristbands have numbers, and so when we're tracking the number of survivors, tracking the immediates, we have a survivor number that we can attach to them that's unique. And so that way we can call in. The concern is you find someone who's unconscious somewhere, you transport them to the medical treatment area, and now when they're being treated, nobody knows where this person came from. Nobody knows what possibly happened to them. They don't know who brought this person in. It's a problem. But if from the very start you say, okay, we have this person, we found this person unconscious at this location, we've tagged them immediate, we're going to transport them to the treatment area. Their survivor number is 1357. Now that's documented. It's documented where they came from, and they can track that number all the way through. Otherwise, it becomes problematic because you can't always get someone to explain to you where they came from if they're already unconscious. All right, here's the fun part. Let's get the poll up. Okay, you should have a poll pop up on your screen. Survivor number 1 is a 15-year-old male. Breathing normally. He is alert, coherent. He complains about a sharp pain in his leg. You assess that he's breathing, that he's not breathing too fast, too slow. You check his capillary refill. It refills within 2 seconds. He can answer questions and perform simple tasks. However, he has a large gash on his leg and it's bleeding heavily. What do you triage him as? Go ahead and mark your answers here. Give you a second. Now, the other question is, what do you do about that large gash in his leg? It doesn't take very long to put a 4x4 on it and try and cover it direct pressure. But the problem is that you're going to move away from this person. So what you might do is you put the 4x4 on there and tell him to hold it. If it's squirting blood, it becomes more severe. That's when you really want to start considering putting that tourniquet on there, because that direct pressure might not be enough to stop that. If it's a leg injury, you have the femoral artery down there, that is under so much pressure that you need to do something a little more severe than direct pressure. Otherwise, this person will bleed out. By the time you get back to him, he might have extenuated and died. So, only 12 people have answered. We have a mix between delayed and immediate. So far, it's about neck and neck. Okay. I can see why. This is where we're going to fall back to the 32 can do. Are they breathing more than 30 times a minute? Breathing normally, so that's a no. The 2, is their capillary refill more than 2 seconds? 2 is not more than 2, so that's a no. Can he follow simple tasks? Can do? Can he answer questions, perform simple tasks? The leg gash is what's probably throwing you off here. You fall back on the 32 can do. The leg injury, even if it is, you have to throw a tourniquet on there. He hasn't reached the point yet where he's going to die in the next 60 minutes. And so the answer is actually delayed, but I threw that leg injury in there to confuse you. You want to fall back on 32 can do. If he fails any of those, then he's immediate. If he doesn't fail any of those, he's delayed. If he got up and walked out when we called for him, he would have been walking wounded green. Fortunately, nobody marked him as deceased. That's good. All right, moving on to survivor number 2. Somebody's already marked this. Female, 16, breathing rapidly. Now, you're not going to count, but this person looks like they're breathing fast. They're alert, coherent, complaining with stomach pain. They're visibly pale, and you check their skin, their capillary refill, it refills within 5 seconds. It's really slow. She can answer questions and perform simple tasks. There's no obvious signs of bleeding. What do you triage her as? Um, I think you scroll down to survivor number two.
Yes, but if you submit, it goes away, so you have to re-enter it for us.
Um, who I didn't end the poll.
But I hit submit and it went away.
Oh,
Yep, me too. Mine's
I
gone.
hit, I
Same
hit
here.
submit
Why?
also, and I have nothing to vote on.
well, that's not helpful.
Same with me.
Okay,
Me
so
too.
thank you,
Question at a
Zoom,
time.
for making this fail miserably. All right, throw your answers into the chat. Anybody think she is walking wounded or green tagged? Anybody think she's deceased? I'm seeing immediates here. No one's saying delayed, so that's good. So yes, that breathing rapidly, you don't even pass go here. She's breathing rapidly. There's no need to do any other tests. She's immediate. Again, you're not counting. She's breathing too fast. She's obviously breathing too fast. Yeah, she's also pale, and that's not good. But just because she's breathing too fast, visibly too fast, you're going to mark her immediate and move on. All right, survivor number 3, female, 14 years old, not responding, not breathing. You attempt to do the head tilt chin lift on her, and she does not start breathing again. So, you let go. You then attempt a second time to do the head tilt chin lift. As you do the tilt the second time, she gasps for breath. She has a 2-second capillary refill. She regains consciousness, and she can answer questions and perform simple tasks. There's no obvious signs of bleeding. What do you mark her as? I'm seeing immediates. I'm seeing a delayed here. Anybody gonna mark her walking wounded? Anyone gonna mark her deceased? All right, so we got a few people saying delayed now. So what did she fail at the very beginning? She wasn't breathing. We got her to start breathing again, and she regained consciousness, which is good, but we don't know why she stopped breathing in the first place. So the answer is immediate because we don't know. We had to do something to get her to start breathing again. Now she is. Hopefully, she's going to she's going to be fine after this, but we're still going to mark her immediate because we want the professionals. We want her to go to the hospital and have the doctors actually look at her and make sure she's okay. So the answer is immediate, but I intended this one to be confusing. So those of you who marked delayed, this was a trick question. Survivor number 4, 13-year-old male, breathing normally. Lethargic, responds to your questions slowly. 2-second capillary refill. He doesn't know where he is or what's going on, and he can't perform simple tasks. There's no obvious signs of bleeding. What do you triage him as? Anybody say walking wounded? Anybody say deceased? Bunch of people saying immediate. One person saying delayed. Immediate. What test did he fail? Couldn't follow simple directions. Simple tests. You get a feeling something's wrong here. He's lethargic. He's responding to questions slowly. Doesn't know what's going on. Confused. Something's wrong here. Yeah, he's breathing normally. He's not bleeding, obviously. His capillary refill's normal, but something's wrong. And you just get that impression and you can't follow directions. You're gonna have to mark him immediate because you don't know what's going on. Maybe this is his normal state, but we don't know that. We don't care. He can't follow simple directions. We're gonna mark him immediate and move on. Survivor number 5, female, 12 years old, not responsive, not breathing. Does not resume spontaneous breathing upon the first, no, I can't speak today. First, head tilt, chin lift. You try it again. Second, head tilt, chin lift. Does not regain breathing, spontaneous breathing. She does have a 2-second capillary refill, but she can't answer questions. She's not responding, can't follow simple tasks. There's no obvious signs of bleeding. What do you mark her as? Anybody mark her as green? Walking wounded? Immediate. Okay. So she's not breathing. You attempted to do the head tilt chin lift. You gave her 2 shots at this. You can't get her to breathe. If you spend any more time on this, other people might die. Unfortunately, she is dead. She's gonna get black tagged. There's nothing you can do about it. Um, Obviously, if this is your child, you're gonna try and do something about it, and there's no blaming you for that. But if this is someone you don't know, you're gonna have to black tag her and move on. Yeah, expectant. Um, she might still have a heartbeat here. Obviously, her skin is responding. She probably still has a pulse, but you can't get her to start breathing again on her own. She will, you expect her to unfortunately die. Number 6, female, 13 years old, breathing rapidly. That's a problem, right? She's alert, coherent, complains about a sharp pain in her leg. 4-second capillary refill. She can answer questions and perform simple tasks. You notice that she has a large gash on her leg, and as you examine it, blood begins to start spurting. Let me ask you this. What do you do first? Anybody?
Stop the bleeding.
Yeah, exactly. Stop the breathing. Bleeding. Stop the breathing. Yeah.
Stop
If you
the
don't
bleeding.
stop the bleeding, she'll stop breathing. That's for sure. So at this point, you might instinctually try and do direct pressure on there, and there's nothing wrong with that. But the spurting blood, especially on a leg injury, you want to start thinking about that tourniquet. If you don't have one, you might only be able to do direct pressure. If you have a triangular bandage, maybe you can do a pressure bandage on it. But um, what you don't want to do is think, I'm going to use a belt or I'm going to use rope or something and try and makeshift a tourniquet. You can try maybe with if you have a triangular bandage and a pencil or something to make a windlass, you can try and do that. That's a little more advanced training. They do teach us in the CERT training. They do teach us in Stop the Bleed. But when you see spurting blood, start thinking tourniquet. And this is why if you have commercial tourniquets, I will take a second here to talk about this. Real tourniquets cost money. They're about $30 each. There are some places that sell tourniquets for less than $20. There are some knockoff tourniquets that are made very cheaply. There was a police department or a EMS agency, professionals, government funded, that bought tourniquets on eBay. What happens is they're poorly constructed, they bend, and the windlass snapped when they were applying the tourniquet. And so be very careful about where you're buying commercial tourniquets if you're going to buy them. If they're too cheap, if they don't appear to be a North American rescue combat applicant tourniquet or a name brand tourniquet, stay away from them. I've had people at a training bring me their tourniquets, and I could literally bend the windlass in my hand. That will snap, and you're in bad shape if you're trying to save someone's life when that happens. So, apply a tourniquet if you have one. Try and do something to stop the bleeding. Once you get the bleeding stopped or under control, mark her immediate, and then move on. If you have someone who can stay with her, she's probably going to go into shock very quickly. But if you need someone to keep doing direct pressure, that's the best you can do, then have one of your walking wounded stay with her. Survivor number 7, female, 12 years old, breathing very slowly, very slowly. She's lethargic and responding slowly to your questions. 2-second skin perfusion, that's normal. She can answer questions and perform simple tasks, but everything is slow. There's no obvious signs of bleeding. What do you mark her as? Here it's, I feel something is wrong. She hasn't clearly failed anything. She's not breathing too fast. She's able to follow directions. She's able to answer questions. Her capillary refill is normal, but something doesn't feel right here. In this case, I'm going to mark her as immediate. It's that gut feeling. Something is wrong here. It could be mental. It could be something else. This might be her normal. But I'm going to err on the side of caution here and mark her as immediate, even though she passed all of her tests. But if you say delayed, you're perfectly fine with this one too. This is one of the ones where you just think something is wrong, and I would rather err on the side of caution on this one. Survivor number 8, male, 17-year-old. As you approach, you notice that he's gasping 4 times a minute. It's roughly every 15 seconds. His eyes are wide, can't talk, skin is ashen, 5-second skin perfusion. Can't answer questions, but he can perform simple tasks. There's no signs of bleeding, but has severe bruising on his neck. What do you triage him as? Bunch of people saying immediate, no one saying green, that's good. Some people saying black or dead. This is a trick one. I would probably mark him as immediate, but I would keep a very close eye on this person because I'm pretty sure he's not going to survive. There's a lot of things going on here. That bruising on the side of his neck might indicate that there's something going on. There's some internal injuries. The gasping 4 times a minute every 15 seconds. The test is he breathing faster than 30 times a minute? He's breathing less than that. But that 4 times a minute tells me that that's agonal breathing, and he's probably not going to survive. So I would be, he's conscious, he can perform simple tasks. I might not tell him, oh, you're going to die. I would say probably here, hold on to this red tag, and I would keep an eye on him. But if you also mark him black, I wouldn't say that you're wrong either. I don't expect this person to make it, but I would also caution you on how you treat this person as well, because if you write him off as dead, and other people see you do this, it doesn't look good. You want to be kind and compassionate to people, especially if you're the last human face they're going to see. Survivor number 9, female, 17 years old, breathing normally, alert, coherent, complains of pain in her abdomen every 10 minutes, 2-second skin perfusion. She can answer questions and perform simple tasks. Oh yeah, she's 9 months pregnant. And there's clear liquid on the seat and floor beneath her legs. What do you triage her as? Green tagged. I like that one. She can get up and walk out, so not green tagged, not walking wounded. Anybody gonna mark her black tagged? Um, this is one of the trick questions here. This is where you can fall back on the 32 can do. She's probably in active labor. Her water's broken. Um, at the very moment, she passes all the tests. She's breathing normally. Her skin perfusion is normal. She can follow directions and perform simple tasks. She's delayed. However, you can expect that that may not stay the same when that baby starts to decide it's going to come. Um, her breathing is going to increase. Um, she may go into shock. Um, certainly things might move her to immediate, but at the very moment you're going to mark her as delayed because she passed all the tests. So keep an eye on her, maybe have someone stay with her because her condition may change quickly and she may become immediate. But at the moment, everyone saying that she's delayed is correct. Active labor in and of itself is not mean that she's going to die in the next 60 minutes. Um, but you need to keep an eye on the people who may go into shock because they might be fine right now, but you know something is wrong and you know their bodily systems are going to get thrown off by something. Active labor, probably going to do that. And so be ready to up her to immediate and see if you can get her some help. But at the moment, this is a trick question. She's delayed. We usually during the drills have a male pregnant in labor just to really throw people off, but usually delayed. Survivor number 10, male, 50-year-old. Breathing rapidly, alert, coherent, complains of sharp pain in his leg. 5-second capillary refill. Answers questions and can perform simple tasks. His legs are pinned under the steering wheel. We triage him as. Yeah, assign someone to catch the baby, yeah. Fortunately, women who are pregnant and it's their first baby are usually in active labor for 8 to 16 hours, I believe. They're in active labor for a very long time, especially if you ask them that. So if she's just gone into active labor, you probably don't have to get ready to catch. If this is her fifth child, that
What?
changes. So after the first or second birth, um, it's no longer 8 to 16 hours. It can be very quick. And someone who's had 3 kids, it could be 30 minutes before that baby
The
pops out.
hell?
That's when you're getting ready to catch. And babies are slippery. Don't drop the baby. All right, so yes, immediate, obviously. A lot of things going on here. Breathing rapidly, 5-second skin perfusion. The legs trapped under the steering wheel are a problem, especially if he's been there for a while. There's probably not much you can do. You're gonna try and maybe get him out. But this is probably the fire department needs to get this guy out of here. All right, so some notes about triage. It's not a one and done. You're not going to triage someone once and then never re-triage them again. You're kind of constantly reassess them. Things can change. Someone can be delayed right now and then get worse and become immediate. Generally speaking, they're not going to go the other direction. Someone's not going to be immediate and then become delayed. Once they're immediate, things are going downhill. The caveat to that is someone may triage that person incorrectly. And so as you re-triage, you realize, oh, this person was incorrectly triaged. Let's triage them correctly at this point. But generally speaking, you're not going to go the other direction. And unfortunately, if you don't do something, they might go to black tagged as well. And that's what you want to try and avoid from happening. Accountability is key. Track how many survivors you have. If you had 5 and now you have 3, what happened to the other 2? People with head trauma or some other condition like that may get up and wander away, especially if that's the only condition they have. So, and we do this at drills all the time. We'll have somebody who's had a head injury, but no other signs of injury get up and wander away when we notice they're being ignored. So make sure you're keeping an eye on your survivors. What you can do if you're trying to track is if you have the tape, tear off a piece of the tape, put it in your pocket. Every time you label somebody, take a piece of that tape, put it in your pocket. That way you have accountability when you walk out of there. If you're doing the wristbands or the triage tags, agree ahead of time where you're going to put this tag. Say, okay, we're gonna tag everybody on the right wrist. If they don't have a right wrist, they're missing an arm, and tag them on their left wrist. But that way, when you go through, everybody's tagged on their right wrist except for this person who has a right wrist but no tag. They didn't get triaged, and now you know to assess them. Use the same terminology. Say, okay, we're going to just use colors. We're going to do green, yellow, red, black. Perfectly fine. Don't say, oh, this person's red tag, this person's immediate. It just confuses things. Keep it simple. We're going to say walking wounded, delayed, immediate, dead, or deceased or expectant. Or we're going to just use the colors. That's perfectly fine. Again, walking wounded, I prefer that over minor. As we've seen, we had 9 minors and 1 adult. What does that mean? Well, it means we had 9 people under 18 and 1 adult, not 9 green tagged and 1 other. After you do the initial triage, everyone's been triaged. You need to start making a plan to get them out of there. Move them out because you want to get them transported to definitive care where they can get treated, or get them to a medical treatment area where you have some people. You might not get an ambulance anytime soon. So make sure you have a plan on how to get them out of there, especially the ones who are more severe and need to be treated immediately or they're going to die. And again, as they get treated, as they get moved, you're going to re-triage them, reassess them, make sure that they're not getting worse. If you have backup, you're a 3-person damage assessment team, pulling people out of the bus is going to be very difficult. So if you have backup coming, you want to wait for them if you can. If things are bad, there's a fire on the bus, and now you need to get people out of there real fast. Do what you can with what you have, but don't put yourself at risk. You don't want to die in that fire because you were trying to save one person who's going to die anyway. It's bad to say that, but that's the reality of it. If you die in the fire trying to save someone who you couldn't save, what good did you do? You can't do anyone else good at that point. And again, don't forget the walking wounded. We had people get out of the bus, walk over there. We need to go check them, make sure that they're okay and they're not going to die, that they don't have other injuries that they didn't know about, and the adrenaline is now wearing off and suddenly they start losing consciousness on you. We can use triage in our normal life, and my life has been chaotic, really chaotic. I can't even, I only know today's Wednesday because this is when I'm giving the presentation. 3rd Wednesday of the month. That's about as good as I've got it. I think tomorrow's Thursday. And it's been going on for the last couple weeks like this. But what we can do is use the color coding and delayed immediate triage for organizing our life. And the way I do it is I sort things that I have to do by priority. it has to be done right now, or it's going to cause me more problems later. It's red or immediate. If it's already too late, I'm past the deadline on this, but it's not going to get worse. I've already missed the deadline. I'm already in trouble. It's not like missing the deadline by a couple more days is going to make this any worse. It's black tagged. I'm not going to prioritize that over the things that I can still get done before the deadline is over. Um, but if it's something easy and I can get it out of the way, it's not critical, but it's just something fast, I'm gonna tag that green. Um, I can feel accomplished by getting a little thing done, and then I don't have to worry about it. But it wasn't a priority. It was just something easy I could do. Everything else is yellow, delayed, somewhere in the middle. Um, we forget the value of accomplishing one task. And in the military, the first thing you do in the morning is make your bed, because when you get back to your bunk or whatever after a long day, you feel miserable, you don't think you accomplished anything, you've been yelled at by drill sergeants all day. At least you know I got one thing done, I made my bed. And that momentum might actually help you not feel so bad about yourself. I at least got one thing done in my life, in my day, and everything else is manageable, or everything else, I'm going to deal with it as it comes. But if I didn't get anything accomplished, I didn't even make my bed this morning, what did I even do today? Nothing. So, red tat things. Um, again, I need to get this done today or it's going to get worse. This is my top priority for the day. Other things can wait. If I have multiple things due today, I want to focus on one thing at a time. I have a problem. I work in IT. I will work on multiple projects at the same time. I don't accomplish anything. I move my projects forward, but I don't accomplish anything because I'm working on 3, 5, 10 different things all at once, and I never get anything done. But if I can get one thing done, then at least I can cross that off my list. And then I can work on the next thing, and the next thing, and the next thing. It might not be an option for you, but it is a way to at least see if this is something you can do, because the value of crossing a task off your list, it starts to build momentum. Okay, I got one thing done. Now I can work on the next thing. If I can get that thing done, two things off my list, and then I'll deal with the rest tomorrow. At least I got something done. It takes me 2 minutes to wash dishes and put them away. At least I did that. Yeah, I can wait till later to do it, but at least now when I go back, my sink is empty. At least I don't have to worry about the dishes. Easy, something quick, simple, marks that check mark, and you get the catharsis of checking something off your list. Even if it wasn't a big priority, even if it didn't matter, even if it really didn't accomplish anything, at least you check something off your list. And now maybe I can do something else and check something else off my list. Build that momentum. Those deadlines have come and gone. I'm already in trouble, but I'm already in trouble. Um, Let me deal with the immediates, things I can still get done. I'll get to this later. Now, if it is already late, and if I wait on it and it gets later, this isn't black tagged. This is still red tagged. I'm already late, but the longer I wait on this, the more time, the more in trouble I'm going to get. Okay, I still got to get that done. But if it's already late and it's not going to get any worse being 2 days late than one day late, let me prioritize something else. Just don't forget about it. Like a dead body, if you leave this thing lingering, it'll start to smell. Don't forget about the things that you are already late on. Um, dealing with stress, you know. All right. Everything else is yellow tagged. Um, if I be careful about these because if you say, I'm not gonna worry about these now, the deadline is tomorrow. Tomorrow comes, now these are red tagged. Now these are immediate because I waited and now it's a priority. So be careful about this. If you can accomplish one of these while you're dealing with the other problems, you don't have to worry about the stress of this becoming immediate. And then you can, um, so you try and work on one red tagged task, get a green tag done, maybe one or two yellow tags just to get them out of the way so they don't become a priority later. All right. One of the most important things to talk about is maintain situational awareness at all times. If we're focused, so focused on the one thing, the one patient, the one survivor in front of us, that we don't notice that the bus is filling with smoke, we become a victim too. Breathe that smoke in, we go down and unconscious. And now we become a victim. We brought a victim to the incident. You always want to be reevaluate your survivors, reevaluate the situation you're in. If things start to get worse, get out of there. If things start to get worse and you can get someone else out with you, do so. Um, we don't want to focus on someone getting worse injured than they already are when they could die. Doesn't matter at that point. They're dead. Yeah, we didn't make their injury worse. They're dead. They burned to death in a fire. And we could have gotten them out. And yeah, maybe they're paralyzed, maybe not, but they're still alive. Don't second guess yourself. Don't overthink it. Don't think, okay, but, no. Make a decision, stick with it. If you made the wrong decision, reassess at that point and reconsider your options. Don't be stubborn. Say, okay, I already made this decision. I'm just going to double down on it and to hell with all the consequences. No. Okay, that was obviously wrong decision. I made it fast. I made that decision. Now let's reconsider. Now let's make a different decision and try and fix the problem. But don't overthink it and take too long. When in doubt, stick to 32 can do. It's going to be your standard. They're breathing more than 30 times a minute. They're breathing more than every 2 seconds. Their capillary refill is more than 2 seconds. They can't follow simple directions. They're immediate. Done. Period. They're not, they pass all these tests, they're delayed. Simple as that. You should be able to triage each survivor within 30 to 60 seconds. If it's taking you 2 minutes, taking you 5 minutes, you're thinking too much. You're doing too much. Keep it simple. 32 can do, move on to the next person. Um, we've you've for those of you who completed the basic cert training, there's a lot of questions of what's next. We've put together the neighborhood team program to be the answer to that. If you don't get my email newsletter, please sign up at join.ntp-la.org. It's where I send out twice a month. I send out the trainings we have coming up, specifically in the LA region, but the Zoom trainings are available for everybody on YouTube, on Zoom Live. If you're able to come out to our drills, we put those on there as well. I try and share what the other coordinators is doing as well in the other parts of the city. And if anything, maybe LA County has something going on or there's some big thing on the city or in the region, I'll share that with you as well. For those of you, especially if you live in the LA City area, please sign up to this list so you can get my email newsletter. We're trying to build teams. Doesn't matter if you're cert trained or not. If you want to be part of the solution, we need you. We want to build the team around you and your neighbors. Any questions? No, Elizabeth, you had a question earlier. Did I cover that or do you still have that question?
No, you covered it. Thank you.
Great. Anyone else with a question? I threw a lot of information at you. You all did a really good job. And I say that knowing that I tricked some of you, but that was intentional. If my trick questions didn't trick some of you, I need to come up with more trickier questions. But some of those really did have two possible answers, and I would have accepted either of them, and I admitted that. I don't like dealing with cut and dry. It is or it isn't. There's a lot of gray areas out there, and we want to think about those now before we deal with them in real life. Patty.
Yeah. You mentioned wristbands. That's
Mhm.
something I'd not heard of.
Yeah.
Where do you get them?
Amazon.
Everything's on Amazon. Okay.
Yeah, I mean, I can get like 2,000 of them for like $8. You know, and I can actually thank the previous Central Bureau coordinator, Carolyn Burleson, for that idea. I kind of went, that's dumb. Let's just stick with the tapes. And then during an exercise, somebody's like, okay, well, how do we track the victims? Like, oh, um, wristbands with numbers on them, and they're cheap. Oh, Jen.
I've been doing this for a long time. I mean, listening and whatever. But where are you ever going to be that you're going to have all this stuff with you?
So one of the things we've been doing is putting together staging area kits and putting them in areas with teams, so that when you get to the staging area, you have everything you need to get operational. We're putting the wristbands in there. We're putting radios in there, putting medical resupply in there, clipboards, map boards. We're working with the local teams to do this. We work with the neighborhood council. If you're in LA City, we work with our neighborhood councils to get funding for these. Um, we need a lot of staging area kits. It's not something we'll ever have the complete city done. Unfortunately, we've realized the staging area's operational area is about a half-mile radius from that location, and that's based upon how long it takes to walk the damage assessment routes. That's set at an hour. We're doing what we can. Um,
Okay,
but if you're interested,
appreciate it.
if you're in LA City, you're interested in talking to me after, you have my email address. I'll put it in the chat.
Okay.
Reach out to
I
me, and
just can't get people in my neighborhood to be interested.
that is also a problem.
Yeah.
My email is laftcertcentral@gmail.com. You can reach out to
Thank
me
you.
and we can discuss, and I can put you in touch with your coordinator and see what we can do about getting a class in your area, linking you up with your neighborhood council, doing something. Trying, maybe we could put a drill on, we could see something. Unfortunately, if nobody wants to do anything, some areas are worse than others. Hopefully you just haven't realized that there's like three groups around you that we already know about, and we're going to put you in touch with them.
That would be great.
That's also the idea of the neighborhood team program. Eddie.
Yes, thank you, Patrick, for this great training. My question is, will we be receiving some form of certificate for today's training? Is that possible, or?
No, mostly because I'm not authorized to give certificates of training. Um, I don't know how much, I can't really, I don't know that I'm authorized to give certificates. So I apologize, but it's not even something I'm going to consider.
Okay, thank you, but great training. Appreciate it.
Thank you. Mikey.
Is there an age limit to join the team? Or
Absolutely not. Well, you have to be old enough to, you have to be old enough. And I think that's vague, intentionally. There are some 13-year-olds who act more mature than 30-year-olds. There are some 50-year-olds who you know, act like 12-year-olds. So it's about maturity. Obviously, if you're under 18, you want to have parental consent. But if you so technically, to attend the basic cert training class put on by the fire department, you have to be over 18 or with a parent or guardian.
Okay.
But if you're, your parents, if you're underage and your parents want you to do this, bring them. Do this as a family.
All right. Thank you.
All right. Any other questions, comments, editorials? Then thank you, everyone. My email address is in the chat. If you have any questions, want to reach out to me, you can email me at lafdsearchcentral@gmail.com. And thank you all for giving me almost 2 hours of your time tonight. And we really appreciate you. We do this for you. If you weren't here, then I would stop doing this. So have a good night, everyone, and hopefully see you next month, third Wednesday of the month from 7 to 9 p.m. Pacific time.
All right. Good night, Patrick. Thank you, sir.
You're welcome. Good night.
Good night, sir.
Good night.
Good night.
Thank you.
You're welcome.
May things get better. In
Yeah.
time, you get in sync with time.
Thank you.
Thank
You're
you all.
welcome. You're welcome.
Bye.